welcome to the Integrative Health Convention 2018 online interviews. So today we're going to find out more about shiatsu and energy work with Cliff Andrews, who's speaking at a convention this October. So the Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through various different healing practices. It's an opportunity for doctors and therapists to meet, share, learn, and connect with each other. And we believe that true health is holistic and that people get better in more than just one way. We also believe that we all have so much to learn from each other, and that the Integrative Health Convention provides a stage for this for therapists, doctors, and the public. There are a limited number of tickets which can be purchased at www.integrativehealthconvention.co.uk. This series of online interviews will help you get to know our speakers who are leaders in their different fields of healing and therapy, or even medicine, and maybe help you decide which talk to attend out of all the 36 talks to choose from over 2 days at the Integrative Health Convention. So I'm your host, Dr. To Wong, and I've been a GP for 12 years in Devon. I am a co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. Neurolinguistic Healthcare provides advanced courses in communication skills and therapeutic techniques, as well as training in hypnosis for healthcare professionals. Today, I'm speaking to one of our excellent speakers who's coming to the 2018 Integrative Health Convention at the Park Plaza Victoria in London to share with you what they know and to tell us a little bit about who they are and what they do and what to expect from their talk at the convention. So this is Cliff Andrews, and hi Cliff.
Yeah.
And he's an international shiatsu practitioner and teacher. And his work can be found on newenergywork.com, and I'll put the description down below and the link that you can follow. Hi, Cliff.
Hi. Thank you very much for inviting me. It's great to be able to talk to you. It's really, really nice to be here. And thanks for inviting me to the convention. That's great. Thank you.
We're glad to have you.
Mm-hmm.
Should we begin by letting our audience know a little bit more about yourself and anything that I didn't cover?
Yeah, sure. I mean, I've been practicing shiatsu since 1981. And I was very lucky because I trained with lots of different teachers, but then I was apprenticed by one of the world's leading teachers in America. And I actually lived in her house and did an old style apprenticeship with her. And then I went on to teach shiatsu all over the world for 30 years. Sometimes assisting her, Pauline Sasaki, my teacher. I've got a shiatsu practice here. In fact, this is my shiatsu room here, right behind me, in Norwich, UK. And I also got a practice in Zurich, in Switzerland. And now, as you just said, I'm also moving into doing online delivery of shiatsu and energy work advanced topics online. And that's my current project. At the moment, I'm working 3 or 4 days in the clinic here. Sometimes I'll be in Switzerland, and the other times I'll be developing online training. That's where I am at the moment.
Great. So one of the things I've been asking all our speakers is that I'm curious what brings someone to be interested in their field.
Yes.
So in health and healing. Can you tell me about how you got interested in what you do?
Yes, I can. It all really dates back to when I was in secondary school, because I was a very keen science student. And I was studying A-level science, and I went on to do a science degree at university. But I had another life, which is I got into yoga at a very early age, and meditation. And a lot of the experiences I had in yoga and meditation, I just could not fit them with the worldview that I was being told about within traditional scientific framework. And that was really my main interest, really. Was like, how can I explain, or how can I understand these experiences I'm having in yoga and meditation within a scientific context? And I went on to follow that up very much at university. And then when I finished university, during university as well, I was studying philosophy of science. I studied different worldviews, like the Chinese worldview and things like that. And then when I left university, I didn't really know what I was doing. I was hanging out in Brighton, wondering what to do with my life. And I just happened to go along to a shiatsu workshop, and that it just hit right on everything I was interested in, because it had the healing side of it. It had all of the vast, huge technology of Eastern medicine, all of the philosophy, the theory of the, acupuncture theory and everything. And it also had the meditative aspects. So it had like the healing aspects, the philosophical aspects. And not only that, it was just wonderful to do. I mean, it's just such a lovely thing to receive. It's a fantastically relaxing, integrating type of therapy to receive. And it's also, the thing I really loved about it more than other types of bodywork that I'd studied, is that because it's a typical Asian thing where it's reflexive, a lot of it's to do with your own training, your own alignment, your own self-development, which fitted in with the yoga side. So it just all came together, and I was just hooked immediately. And that was a very long time ago now. And I just started out. And at that time, there were no shiatsu practitioners in the UK, no professional shiatsu practitioners, no schools, absolutely nothing. And so I had to really travel all over the place and find teachers abroad. And then eventually I set up one of the main shiatsu schools in the UK in 1986. That was with Carola Beresford-Cook, who's a famous author, Paul Lundberg, who's a very respected acupuncturist, and Nicola Pooley, who's another wonderful healing person. And the four of us set up the Shiatsu College, which is now a big school in the UK with several branches all over the UK. And during that time, I also started traveling with my teacher all over the world, and it just kind of grew. And I just somehow managed to keep floating to the top of this huge thing that grew. And it was just entirely a kind of enthusiasm, I suppose, really, that came out of my desire to try and make sense of the world, I suppose. That's my story.
Wow. And the enthusiasm certainly comes across. Thank you.
Yeah.
And at the convention in October, you're going to talk about a practical guide to diagnosis and treatment using advanced energy work techniques. And traditional Chinese medicine.
Yes. And the reason for that is because I'll tell you a little experience I had that really stayed with me. And that is, I went to the Science Museum. If you ever go to the Science Museum in London, you must go up to the top floor. There's the Wellcome Institute have made this amazing history of medicine floor. I don't know if you've been up there. It's absolutely fantastic. But the most fascinating thing for me is that in the whole floor, there's like all the different traditional forms of medicine, like Egyptian medicine, ancient Greek medicine, Oriental medicine, Chinese medicine, Indian, Ayurvedic, the whole thing. And then there's the whole section on Western scientific medicine over the last 200 years. And the most fascinating and standout thing from that for me was that Western medicine, for all its absolutely incredible achievements, and I never want to take away from those amazing achievements that quite obviously has, it's the only system of medicine in the world, in the whole history of thousands of years of medicine, that does not have the spiritual aspect of the person integrated into the healthcare. And obviously with my philosophy of science background, what I knew about the structure of science from university, that was a really interesting thing for me. So what I've been working on over the last 10 or 20 years is trying to take the theory of Chinese medicine, which incorporates the spiritual aspects. In fact, it incorporates the spiritual, mental, emotional, and physical aspects, is integrated into the whole system. And what I've been trying to do is actually develop techniques that specifically allow us to address the person on those different levels, actually develop actual techniques to do that. And I've got some fun, things that we can try out in the class to demonstrate that. Because I think, from my point of view, of what I can see around me with my clients, and I can see in the World Health Organization statistics about diseases, a lot of the diseases stem from a spiritual origin, a dissatisfaction, a deep dissatisfaction with the world that we have created around us. And that's where I can see a massive contribution for traditional healing systems, because unlike Western medicine, which, like I say, for all its advantages, has been, since the Enlightenment, has been part of the scientific method, it's basically a materialist-based system, which has huge advantages because it can understand how well the body works as a machine, But the weakness of that is it tends to systematically exclude the spiritual and the higher vibrational aspects of the being. So that's my interest. That's my sort of passion to try and integrate that in.
That sounds like it fits perfectly into the integrative health convention, where there or the audience is made up of doctors, therapists, and the public. So,
Yeah.
Where do you think it fits in this integrative health, this holistic health?
Well, I think the thing that I think is that it enables us to have an alternative way of communicating, an alternative way of actually addressing both ourselves and our patients or clients in a way that is truly holistic, that truly is holistic from the ground up kind of thing. And that's the thing that attracts me about Chinese medicine, because Chinese medicine has a continuous development from pre-scientific times. And those particular, it's a technology, really. It's a technology of linking the spiritual, mental, and emotional bodies, if you like, with the physical body. And it's that I think makes shiatsu and other types of bodywork like that so powerful, especially when you can link it with. And I've done a lot of work with Nick. Actually, Nick's on the convention, isn't he? Nick Pohl. He's a clean language guy, and he's actually one of our students. He graduated from the Shiatsu College back in the day. He was one of our first students, and he's written a superb book about clean language and the body. And what that does is it encourages people to use metaphoric language to explain what's wrong with them, what's happening to them, what they would like to happen in their lives. And the fascinating thing for me is that in my own practice, I've found that consistently the Chinese medicine system is extremely useful at interpreting metaphors. And you get this time and time again. I went to the doctor or I went to the hospital. I'm sure that this is connected to this. And they said it isn't. It's impossible. They sent me to the knee department for the knee, and they told me the headaches were this, and like that. And I can just, say from, with complete conviction, look, I can get a chart out and can say, look, according to Chinese medicine, this is all part of one pattern, and it's linked to your spiritual path through life that you talked about. It's a big issue for you. And the relief, the absolute relief in terms of the client, it's just unbelievable. They can just suddenly, they feel heard, Oh, really? You mean it's like, I could say it's straight out of a textbook. All these things are out of a textbook. They are linked, they are linked within the system, and as I say, for all of the power, the huge power of Western medicine, often it can't do that because it's to do with the reductionist materialist worldview, if you want the philosophy of science thing, that basically gives it a blind spot. And even though I know in Western medicine they are trying to make it holistic and things like that, it's difficult to do because the foundation of the system is philosophically based on a materialist system. So it will always tend to treat the body as a mechanism. That's my experience.
Well, that sounds fascinating. And the hope is that the Integrative Health Convention will expand the remit of Western medicine. So
I hope so.
I think, like I was saying, that there's a movement starting already, across in America, and I'm sure it'll spread here soon, where we're looking into working more holistically. Yeah, and I'm sure it will happen. It's just a matter of time.
Yes,
East and West will.
I think it's like yin and yang. It's like a balancing thing. You can only go so far one way before it starts to move back. It's just the nature of the universe.
Yes, absolutely. Like what's happening in China.
Exactly. Yes, exactly. That's exactly the thing. They've gone, really far, but now they're starting to bring it together.
Absolutely.
Yeah. I mean, you've only got to look at the amount of the incredible interest in Qigong. I mean, Qigong is massive now. I mean, everyone is doing Qigong or yoga. It's absolutely massive. And Qigong is so close to Shiatsu. I mean, it's right in the same area. And the thing is that also helps us because people study Qigong, they learn about the meridian system and all the whole thing, you know, and they come in and they say, oh, you know, my Qigong teacher, we did this exercise on this emotion came up, and I go, yeah, sure, right, they're in the whole, you know, zone, you know. And I think that really the whole massive interest in yoga and shiatsu and everything is just the universe balancing itself out. You know, Western medicine pushes you so far this way, it's inevitable that people look something else. Same thing in China. You know, they have a traditional system, they have the whole Mao thing and materialism, they go like that and then they come back. You know, it's just the way it works.
Yeah, funny you should talk about Qigong, because we have an interview as well with one of our speakers, who's John Miller, who's coming to talk about Qigong.
Yeah.
And in fact, about a month ago, the BMJ published an article about how Qigong there was an evidence that Qigong helps with fibromyalgia.
Yeah,
I think that's a long-standing research, but it was publicized again a month ago.
Yeah, absolutely. Yeah, I mean, there's loads of research out there, and the potential is absolutely huge. I mean, especially the other massive thing, of course, is the whole aging population thing.
Yeah,
because you know the West, as you know, is got an increasingly aging population, and Qigong is just ideal. I mean, in China, I'm sure you know, in China they have massive Qigong departments. The hospital have huge Qigong departments, medical, which they have hundreds of people. And of course, the other thing is it's very, very cost effective, because unlike one-to-one therapies like shiatsu, you can have one Qigong teacher, medical Qigong teacher, you can have 50 people participating. It's fantastically economical. And it does all those things that Western health services are trying to do, you know, like put more responsibility on the patient, you know, motivate them to look after their own health, get in touch with their own bodies, and all these things, you know. And Qigong particularly is very low impact. Tai Chi Qigong is so low impact, it's completely suitable for elderly people. You know, it helps with all kinds of different aging issues. So it's just another example of where there's a need, it'll happen, you know.
Brilliant.
Yeah.
So I'm asking one more question, one extra question. So as a therapist and a teacher with years of experience under your belt, what do you think in particular is the key to healing in what you do? So I'm looking for something personal, to what you do that you think makes the most difference.
I think, do you mean from my personal, what I can offer, you mean?
Yeah, no, what do you think when you treat a patient?
Yeah.
Most difference. What do you think it is
that makes the most difference?
Makes the most difference.
I think fundamentally, the essence of any type of healing is basically helping the person be comfortable with the fact that they're a spiritual being that's materialized on earth for a certain amount of time. That's the essence of it. All the rest of it is details and bits and pieces and aches and pains and blah, 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 and the rest of it. But ultimately, that, I think, recognizing that is at the heart of all healing systems, whichever modality you use. I really do. And that's why I feel shiatsu and oriental medicine, like Chinese medicine, has got such a lot to offer, because it provides a clear framework that does that in a very, very specific way, and a very, very sophisticated technology to do that. So you have those tools in order to take that person, that spiritual person, spiritual being, into your practice room. You relate to them through touch, especially with shiatsu, you're relating to touch, which is a very, very powerful form of interaction in itself. Not only that, but you're trained in order to create a kind of specific type of touch by using your whole being, yourself. So it's reflexive, and it's creating that space where that person can truly be who they essentially are in that moment. That is the true center of the healing process. That's what I've really come to understand, I think.
That's amazing. I'm really looking forward to attending your talk. It sounds absolutely amazing. I'm sure our audience and our delegates will get so much out of it.
I hope so. Yeah, I'm really looking forward to it. I am. Yeah, it'll be good fun.
Great. Um, and I do wish I could attend all these amazing talks, but there are 36 different ones to attend, and hopefully this will have this interview here will help our delegates choose which one to watch and which one to come to.
Yeah, sure. Yeah, great.
Thank you for taking the time to talk to us, and thank you to the audience for taking the time to listen to this interview.
It's my pleasure. It's my pleasure. I look forward to meeting you face to face.
Yes, that's right.
Yeah.
Me too. And so just to the delegates and to the audience who've been watching this, remember to get your tickets early from our website. So you can follow the links below. And we are the Integrative Health Convention in London on the 13th and 14th weekend in October 2018. You can, as a gift, you can use the discount code podcast10, which I'll put here, which will give you a 10% discount. And that's a gift from us to you for your time. So when we see you in October in London, you'll get to meet myself and Cliff here and all the other speakers who'll be sharing so much more with you then. Thank you very much.
No problem. It's a pleasure.